I am Dr. R.K. Gopala Krishna. I am the consultant urologist at Fortis Kidney Hospital in Kolkata. I am a reconstructive surgeon and I have been using the Mantra 3 robotic system for the last 1 year. I have been using the Mantra 3, that is the latest version of the Mantra robot, the Indian robot, for the last year about. And my experience has been fairly satisfactory. This is the Mantra 3 version, which has got 4 arms with the additional 4th arm for retraction and assistance. I find it quite convenient to use. The good point is that it has got an open console, which is similar to laparoscopic systems which we have been using for the last 15 years. So it is a pleasant transition from laparoscopy onto the robotic system. Most favorite features for which I like this system is, number one, it has an open console which gives an open experience. It makes you feel that you are in the theater along with the other members of the operating team. Number two, there is no claustrophobia or feeling of loneliness. And the second or the last thing which I said just now was the most important part, is that it allows quick conversion to laparoscopic surgery whenever that is necessary, without changing the camera, without changing the telescope, or without changing the ports. I have been doing laparoscopic surgery now for more than 15 years, since 2007. So for me to get onto this Mantra system was not very difficult, because the instruments more or less move like laparoscopic instruments. So the learning curve was fortunately not very long. And secondly, because it is an open console, the vision is also similar to laparoscopy. So all these reduce the learning curve to a significant extent. In fact, to the extent that after some cases, I was actually feeling quite confident to mentor other doctors or other urologists who wanted to get onto this system. So therefore, this certainly does not have a very long learning curve, and it is easy to practice. Regarding the support and training and proctorship, I think they have a very good system in place. They gave me quite a good number of hours, as many hours as I required, for learning the instrument placements, the finger controls, the device controls, the foot pedals. So only when I felt confident about it that they allowed me to, or they permitted me to get on to an actual live surgery. Secondly, they also provided us with proctors to come in and stand by our side during the initial surgeries. So I think they have got a fairly robust training system and a mentorship system in place. The most important thing about the Mantra robot is that it's affordable. And especially in India, that is a very important factor. So I think that allows us to apply the robotic system to a larger number of patients who may require the robotic system to be used for them, for their treatment or for their benefit. So overall, I would say this is a good robotic platform for our use, which we can apply on a larger sort of clientele of patients. Many of my colleagues who come forward to use the robot, and I have been proctoring them over the last few months. So the system is getting more and more popular, and whenever I go or travel to other places, I do recommend the robot, because I think it's a very good robot to be taken into a theater. It does not take up much space because it has got separate independent arms. So I think for a general theater, this is an easy robotic system to be incorporated, and it can be moved aside as well, so that it doesn't occupy or eat into theater space. I am quite happy that this is an Indian robot. I am quite passionate about it. The fact that it is made in India by Indians, or or conceived by an Indian surgeon. So, and the best part is that with the passing of every year or with every version, the instrument is improving. Newer additions are taking place. So I know that the people who have conceived it are listening to various queries and understanding that it needs to improve with every generation. And that is what is happening. So I think they are receptive and the instrument is getting better day by day. It is quite nice to use. It is affordable. It is cost friendly. So I think these are all plus points for any instrument that needs to be used in this part of the world. So I think it's a good system to use and I would certainly recommend it to all. I would congratulate the SSI Mantra technical team for conceiving such a nice and user-friendly robot for made in India, made for India. I'm sure it will go outside the borders of India to other countries as well, where people would find it quite useful and compare it with other robotic systems. This is going to be one of the best robotic systems that everybody would like to have.